Both men and women go through significant hormonal changes in middle age that can be life-threatening. This doesn't have to happen. Naturopathic physician Dr. Kelly Miller from the Miller Clinic for Optimal Health is here now with more. Dr. Miller, life-threatening? Really? I'm thinking menopause, andropause. Life-threatening?
Oh, absolutely. You know, when a man hits 50, his testosterone has dropped probably 50%. He puts a belly on him, his risk for heart attack has doubled in there. So you have inherent cardiovascular risk is probably one of the biggest things that comes along with menopause or andropause.
Well, let's talk first about menopause and the common symptoms that occur with that. We've all heard of the hot flashes. What else is happening?
Yeah, hot flashes is very common. Night sweats, loss of muscle tone, weight gain around the middle, more anxious, depression. You know, it's amazing how many 50-year-old women are put on Prozac, and I tell women they don't have a Prozac deficiency, they have a progesterone deficiency. So that's one of the biggest things, loss of libido, painful intercourse because you have drying of the skin, drying of the hair, you have vaginal dryness, so all these things are occurring.
Just a barrel of fun, isn't it?
Right.
It doesn't have to be like that, though. And for andropause, tell us about the symptoms that come with that.
Yeah, well, andropause is the men's counterpart to menopause, so that's something you haven't heard of as much, but it occurs around 50, but it could be 45. I actually had a patient the other day, came in from Miami, and he is actually in full-blown andropause at age 39.
Oh, goodness.
So what you see is a change because of the drop of the hormone, you see change more, again, weight gain around the middle. You have loss of confidence, loss of decision making. You know, have these CEOs are very, decision-making people, very sharp thinking, and now they can't, so it's very disconcerting to them. They also, the biggest thing, of course, you see on the media is loss of libido or erectile dysfunction.
And a lot of people hear about hormone replacement therapy to help alleviate some of these symptoms. Now, there's a synthetic hormone and there's a natural bioidentical hormone. Tell us about the difference.
Good question. So there's a world of difference. For one, when we talk about natural bioidentical hormone, we're talking about something that's made plant-based from yams or potatoes usually, but it's exactly identical as our body works. The hormone system is a lock key, so this is exactly the key that's made for your lock, your receptor site. When they make a synthetic hormone, they have to change it, alter it to patent it, because you can't patent a natural substance. So it's that alteration that creates the problem. And also the amount of hormone that they're using in women, which we already know has caused problem, and men now, is multiple times more than we naturally produce.
So I take it, use the natural bioidentical hormones only in your practice?
Absolutely.
And how quickly can people start to feel better when they start?
You can see changes. We'll see a change within a couple of weeks, but usually, depending on how long this ago, it may take up to 3 months to totally rebalance somebody. But usually within 2 or 3 weeks, they're seeing very positive changes.
All right. And I imagine creams?
Yeah, we like transdermal, and we use the German technology of liposome technology, which is probably the biggest breakthrough in nutraceuticals in the last 10 years because it increases the absorption rate.
All right. For more information, go to this website, drkellymiller.com, or call 813-774-3744. Dr. Miller is offering a special 50% off the first visit for new clients. Thank you, Dr. Miller.
Thank you.
Be right back.